Would you mind to like and subscribe to keep it free for others? You too can send your results.
I am a little shy to use my real voice, so that please forgive me to use pre-recorded voice.
The question.
I've been trying to find more definitive info to no avail. I had a radical prostatectomy 2 years ago for an aggressive form of prostate cancer. My PSA was within normal range for a while following surgery. I stopped follow-up visits to my urologist after a few months, until nearly 2 years post-surgery, and after several periods of extreme unexplained illness over a period of about 8 months, I had blood tests done, and my PSA was 426, not a typo. I had it checked again about 2 weeks later, and it was 495. I still have further testing to undergo, but I still can't get a straight answer regarding my PSA number. I've been told by 3 doctors so far that these numbers are beyond high. They're unheard of. I just want to know what a PSA of nearly 500, almost 2 years after prostate removal means. I'd really appreciate some insight.
Professional explanations. For ordinary people.
Trustworthy information by medical professionals.
Results interpretation.
This sounds like an incredibly stressful and worrying time. Dealing with unexplained illness and then receiving such alarming test results, especially after having undergone a radical prostatectomy, must be very difficult. However, I can provide general, medically sourced information about what a PSA level of this magnitude usually indicates after a radical prostatectomy for prostate cancer.
So, what a PSA of 400 plus suggests post-prostatectomy? After a radical prostatectomy, the goal is to remove all prostate tissue, which is the source of PSA. Therefore, the expected postoperative PSA should be undetectable, often defined as less than 0.1 nanograms per milliliter or 0.2 nanograms per milliliter, depending on the lab. A PSA level in the range of 426 to 495 nanograms per milliliter, nearly 2 years after the surgery, is extremely high and is medically referred to as biochemical recurrence or persistent PSA. Here is what these numbers highly suggest in the context of a radical prostatectomy for aggressive prostate cancer.
Significant, widespread cancer recurrence. This level of PSA is not typically caused by a small, localized recurrence at the surgical margin. Instead, it strongly suggests a substantial burden of recurrent prostate cancer. Metastasis, spread. The most likely explanation for such a high number is that the cancer has returned and has spread or metastasized outside of the original prostate area to other parts of the body, such as bones, the most common site for prostate cancer spread, lymph nodes in the pelvis or other areas, visceral organs, example lungs and liver. Rapid growth. The fact that your PSA jumped from a normal range to these levels and then increased again in 2 weeks, from 426 to 495, indicates that the recurrent cancer is likely very aggressive and rapidly proliferating. This aligns with your initial diagnosis of an aggressive form of prostate cancer. Two. Connection to unexplained illness. You mentioned several periods of extreme unexplained illness over the last 8 months. It is highly probable that your elevated PSA and the aggressive cancer recurrence are the underlying cause of these systemic symptoms. The symptoms of metastatic prostate cancer can be varied and nonspecific, including bone pain if the cancer is spread to the bones, fatigue and weakness,
unexplained weight loss, and general malaise or feeling unwell. What your doctors are likely doing next. The reaction you received from the 3 doctors, beyond high, unheard of, reflects the severity of the lab result, as these numbers are indeed at the high end of what is typically seen in recurrent prostate cancer. The next steps for diagnosis and treatment will focus on staging, finding where the cancer has spread, and therapeutic intervention, starting treatment immediately.
Common tests and actions include imaging scans, staging to locate the sites of cancer, bone scan to look for cancer in the bones, CT scan or MRI to check for enlarged lymph nodes or masses in other organs, advanced scans, e.g., PSMA PET scan. These are highly sensitive scans that can often pinpoint even small sites of prostate cancer spread, which is critical with such high PSA numbers.
2. Hormone therapy initiation. Given the high PSA, treatment is usually initiated quickly. The standard first step is androgen deprivation therapy, or ADT, which aims to stop the production of testosterone, the fuel for prostate cancer.
3. Oncology consultation. You will need to be under the care of a medical oncologist who specializes in prostate cancer to discuss long-term systemic treatment options, which may include hormone therapy, chemotherapy, or newer agents.
Bloodtestsresults.com. Happy to help.